Let's talk about the other care directives. When are we looking at creating those?
Healthcare power of attorney, again, should be done after the age of 18, because what people don't often understand is that if you do not complete these documents, the state has a very clear designation of who would be your decision maker. To begin, it would be a spouse, and most people will say, well, I want my spouse to be my decision maker, forgetting that oftentimes our spouse is the very person that's with us during a really serious accident.
Yeah.
And now they can't make those decisions for us, let alone for themselves. So that's why appointing a secondary agent is important. And if we don't, then after a spouse, it would be the majority of your adult children, and then it goes to your parents, and then it goes to a domestic partner. And so that person who may be the most important person in your life would be fourth on the list.
So you're saying that if you were in a car accident with your spouse, that the way the law works, that crazy oldest child could be making your healthcare decisions for you.
So I'm not going to go into family dynamics, but yes.
Yes.
Hi, I'm Kenny Klaus, and this is State 48 Homeowner.
Hey, my friend, welcome back to the State 48 Homeowner Podcast. And today we're going to talk about something that a lot of people don't think about because they think, oh, this is something that really only happens late in life, but it actually happens at a lot of different times in life. And I don't know if you know this, but I've been a first responder as a volunteer for about 20 years of my life. And when I was first getting my EMT certification about 20 years ago, back in 2003, it was in California. And I was on scene. It was a gentleman that was at the end of his life, and he was in cardiac arrest, and we needed to do some help for him. And so I was doing compressions. My paramedic partner was there to shock his heart back into rhythm. And the family says, well, hold on, he has a do not resuscitate order. And we asked for it, and they had copies of half of it. Unfortunately, you have to err on the side of caution because it's life or death at that point. And even though they said that they had a DNR, a do not resuscitate order, we actually had to continue life-saving measures because they didn't have the whole document. So we couldn't verify that they actually had a real DNR. And he was a large guy, and so in those situations you have to provide extra strength when you're doing compressions. And I actually broke a couple ribs right as his family was watching, and they had to watch as he was shocked. And then even as we took him to the hospital, he actually passed on the way to the hospital. And so it was actually all in vain. And if they had just had the DNR documents, all of that could be avoided, and he could have had his wishes met. And so fortunately, technology has kind of caught up with us. And now we have some extra tools to make sure that when people make these decisions for their health care, that we can actually make sure that those decisions can be met. And so we actually have a guest today, Carla Sutter. How you doing, Carla?
Good. Nice to be here.
And we're going to be talking about some of these advanced directives that people make. And there's a couple different kinds. We'll get into that. And we also have Don Milburn from the Klaus Team Silver Program. Hey, Don.
Hey, thanks for having me.
And so as we think about advanced directives, I know that everybody goes, oh, that's something for really, really old people. And yet, that's not always the case. I have an advanced directive. It's part of my trust. It's a living will. And then we have what I just talked about, DNRs, but there's a lot of different kinds. So really, what is an advanced care directive?
So thank you so much for the opportunity to be able to share this information. So the terminology I'm going to use today is related to Arizona, but note that every state has forms of advanced directives, sometimes called healthcare directives. And in Arizona, the directives would include a living will, which really can be your map of what specific decisions you would want or not want, and a healthcare power of attorney document, which allows you to name an agent or agents to be your voice for your decisions if you're not able to communicate those. And Arizona is unique. We also have what's called a mental health care power of attorney document that's specific to behavioral inpatient treatments, whether that is for a behavioral diagnosis or a physical diagnosis that's creating some behavior symptoms. And then, as you shared, the DNR document, sometimes known as the out-of-hospital do not resuscitate order, or here in Arizona, the orange form, and that guides first responders and emergency personnel not to resuscitate if you have if your heart has stopped. It is not a do not treat order. It is specific to resuscitation.
Now, when are people deciding on these different things? So we have the living will. When are people deciding on that?
So oftentimes, it's important to note that these documents can be completed after the age of 18. And really should be completed after the age of 18 because we never know when or how these decisions are going to need to come into play. I think oftentimes we think of these documents just like we think of estate planning for somebody after a certain age, maybe after retirement age or specific to a diagnosis. But these documents are really important, again, after the age of 18, when you would need to appoint somebody to make these decisions for you if you can't. And sometimes those decisions can't be made because, yes, you are in an end of life and advanced illness, but many times these come to play when someone's in a very serious car accident. That in the end, they may survive, but they may have a period of time where they are not able to participate in their healthcare decisions. So that's why it is so important at all stages of one's life that we look at these documents. Certainly, the Do Not Resuscitate document is really specific to individuals who, because of age or illness and the frailty that could come, they are making those determinations. That often that's not going to be a document for everyone. But the living will, the healthcare power of attorney, the mental health care power of attorney, all are documents that after the age of 18 can be utilized. You may focus on as much of what you want in your life, what is successful living, versus what you don't want. And that's often easier for people who are healthy because they can't necessarily think about what is to come, but they clearly know what's important, where their environment is that they want to have care provided, who they want to surround them, what is important around communication or pain management. Those are things that they can often talk about in these documents.
So let's talk about the other care directives. When are we looking at creating those?
So healthcare power of attorney, again, should be done after the age of 18 because what people don't often understand is that if you do not complete these documents, and these documents are completely voluntary for you, but if you don't, the state has a very clear designation of who would be your decision maker. And to begin, it would be a spouse unless otherwise legally separated. And most people will say, well, I want my spouse to be my decision maker, so I don't need to complete the document. Forgetting that oftentimes our spouse is the very person that's with us during a really serious accident. And now they can't make those decisions for us, let alone for themselves. So that's why appointing a secondary agent is important. And if we don't, then after a spouse, it would be the majority of your adult children. And then it goes to your parents. And then it goes to a domestic partner. And so that person who may be the most important person in your life, you've spent time with, you live with, would be fourth on the list. And so really having that healthcare power of attorney document is key just to ensure that not only is the first person in place, but secondary people as well.
So you're saying, and I know that there's people on the podcast that this might rub a little wrong, you're saying that if you were in a car accident with your spouse, that the way the law works, that crazy oldest child could be making your healthcare decisions for you.
So I'm not going to go into family dynamics, but yes, it is that it's at that time, the other siblings can't say, well, that's not mom's favorite, so we really should be making that decision. It is going to be the majority of your adult children. And I always think about, in my own family and, how my sister and I, who love each other very much, but making decisions together may not be something we're used to having to do. And then in a crisis moment, it's even harder to do. And so not only does documenting these individuals help, but you also want to communicate that and not be surprised at 2 a.m. from a healthcare provider calling and saying, we're sorry to inform you that mom is in surgery. We noticed that her advance directive names you as her agent. What would she want in these situations?
And it's nice to communicate that not only to that child, but to the others.
Absolutely.
And as parents, we know which one of our kids are best in a crisis. And we know which one of our kids are not best in a crisis. And you don't want to leave it on them because it's not fair to them. It's not fair to the other kids. But communicating it to them and the others. Hey, this is why. They're in town. You're not in town. That's why.
Yes. And there's ways on these documents to allow for people to participate in a medical conference with their physicians or to get access to hearing what's happening without them being the designated speaker for the group as to this is what they would want.
So if I've chosen my person, how do I make it legal?
So you would use a healthcare power of attorney document, and it doesn't matter what version. The state of Arizona Attorney General has a life care planning packet. It has these documents in there. But you may also find the 5 wishes. You may have a faith community that has a document that they have designed that really focuses on the tenets of that faith. So it's not about which form type, it's that you would find one that does represent a healthcare power of attorney document or a living will. The one document you want to specifically really focus on the Attorney General packet form would be that DNR because it is then designed in the way that is the most recognizable to first responders.
Hey everyone, this is Kenny Klaus with Klaus Team Real Estate Solutions. We know there's a lot of confusion in today's market, whether it's billboards, TV, radio, mail, everyone's trying to get your attention. They offer one lane, where at the Klaus Team, we have over 20 different programs we can help you navigate through to find out what's best for you. And remember, we work for you, they work for themselves. We're here to represent you and make sure you have the best experience possible.
Visit us at klausteam.com/call us first. So let's jump over then to that DNR. What's that process look like? Are in most cases, I know, Dawn, we've talked a lot that sometimes it's the person that's deciding on that DNR, and sometimes it's the family. What do those conversations look like?
Well, I think that it's important to be the voice of the individual, and having these discussions ahead of time they're key, because you need to know exactly how they would want you to carry these things out. I know from a personal perspective, both my mother and my husband's mother had things in place, and it sure did ease the way, and the transition and the decision making removed the guilt of those things from us having to say, no, don't do that, or whatever the case may be, just having those things removed.
And it's an uncomfortable conversation.
Mm-hmm.
When you talk to your parents, and as they're planning all these things, it seems like every conversation with your parents is about their impending doom, and it's uncomfortable, yes. But what a gift, like you said, to remove the guilt. Mm-hmm. What a gift from parents to their kids to be able to say, this is what I will want when the time comes, for them to communicate that, and for the child not to have, and usually at this point they're quite a bit beyond that, but for them to not have to guess and think and wonder.
And carry the guilt, because sometimes those are hard calls to make. And to remove the guilt is the most loving thing you can do. For that very reason, and I think like a lot of people that have been through it, after our parents passed, we made sure we had our directives in order. because we wanted to bless our children in that same manner, that they don't have to make those tough decisions, and we don't have to put them through that.
Yeah, I know where all my parents' stuff is. I know exactly what they want, and they've done a wonderful gift to me. Of course, I am tired of all the conversations because it just keeps coming up. But
well, it's a difficult topic.
Yeah,
sure. Yeah,
but I'll tell you, one of those things. I have friends, my age that their parents have gone, and there's nothing better to look at the phone and still be able to see mom's calling.
Right.
So I'm still glad to get those calls, even if the conversation is about the impending doom.
Right. And a lot of people do think of it that way. I know just recently a family member expressed to me frustration with it's an in-law that his parents don't want to talk about it because they feel like talking about it will bring about the death.
Yeah.
That somehow by opening that door something terrible is going to happen. However, one of the parents that we were talking about is having some cognitive issues and starting to have some confusion, and openly admits that. So my suggestion was, instead of talking about it from a death perspective, let's just talk about it from so Mom, we know that you yourself have said that you're having some difficulty making decisions and having conversations. If we can get these things in order, then I will know exactly what you want. This will help. So I said, maybe come at it from that angle, as far as what do you want done when you're unable to speak for yourself. I need to know exactly now why you do have, the ability to make those decisions.
Yeah, and if people are thinking that, planning for this stuff is going to mean that it's going to come quick, let's think about retirement planning. It's pretty rare that you start retirement planning and you're retiring the next day.
Right.
This stuff, it's best to start thinking about it earlier, get it planned, and then enjoy life. I mean, generally we've got a while, even if in a lot of cases, even if we've gotten a bad call from a doctor, a lot of time we have a while,
right?
And we've got time to enjoy. Let's get things ironed out and let's move on. So we've made things legal. Who do we need to tell?
So great. I do want to go back and just share that it is a difficult conversation, but I think one of the things that you can ease that with is not thinking that you have to always just help somebody else, but thinking for yourself. You both have your advanced directives, so I'm speaking to the choir there. But I've found that one easy way to get our older family members or friends on board is to say, I just heard a podcast, or I just heard a friend share some sadness about not having these decisions, and I'm going to complete my own document. I would love to bring extra copies, and you can absolutely take a look at them. We can talk through them as I'm completing my own. But in the end, I am going to complete my document, and if you want to participate, that would be great. And I think that has a 98% chance of working versus, Mom, you need to do this document, because what she's hearing is, Mom, you need to do this document because you're old and frail, and I'm going to take over control. So I think it is about the conversation and just finding that balance. Once these documents are completed, and while many people do complete them with a attorney, maybe they're doing their estate plan, and that's these documents outside of the DNR are often done with an estate plan. But once they are completed, you don't need an attorney. You can have them done and get the forms and have them witnessed or notarized in Arizona. The DNR document does need a healthcare provider signature. But you want to, on the back, what I suggest is on the back of your document is note who you've given a copy to. Where it is, so that if you do make changes down the line, you know who to give new copies to. But it is important to give it to your primary healthcare provider. Oftentimes they're going to be asked if you go in for a procedure, inpatient or outpatient with a hospital. And now we do here in Arizona have moved the previous registry for these advanced directives from the Secretary of State to Contexture, and we now have the Arizona Healthcare Directives Registry. And this is a great place at no cost for individuals to share their documents. They can then be safely stored, give you access through your own account, and also healthcare providers across the state are utilizing the system to be able to search and view for documents, and then also upload any additional documents that someone may have during a stay with them.
And this is something that's pretty exciting. This is where tech has kind of gotten a little bit further into where we need to be, because now we're at the point where we don't need to be lugging our documents around with us. We don't need to make sure that we've got all the pages, that it's not frayed, that we haven't torn off the most important corner of the document. That tell us about what that registry really is.
Well, you shared yourself in terms of the situation that you have not forgotten all these years later, that that family had made some difficult decisions, had completed a do not resuscitate document, but because paperwork gets misplaced, they couldn't follow it. And so we really want to ensure that wishes registered are wishes honored, because the documents are there in full. We view those documents to make sure that they have been completed in a way that they could be followed, and provide feedback back to a registrant if there's any question or concern on the documents they've shared with us. And again, those documents then can be updated. You can send in additional documents. Maybe you've only done one document and now you want to add to that. But it really does ensure that, wherever that care is being provided, you can give access to, often without even realizing you are, because if you're not cognizant at that time, to the people who are needing to know what those wishes are, and then also to your agents to be able to see those documents, and as you shared, Dawn, not to have to be carrying them around with them and losing pages or misplacing them.
The Klaus Team is different. With the Klaus Team, you have someone on your side. Where you live and make memories is important. We have more unique strategies than anyone else to help you accomplish what matters most to you. We can help you with traditional real estate as well as other options such as our lease purchase programs. We can help you buy first then sell, and we can bring you instant offers. We're here to help our neighbors achieve the American dream and help them build wealth through home ownership. For more info or to start your home search, visit us online at klausteam.com. So let's talk about, so you shared there's two different ways that people can access those, one in a clinical setting and one in the field setting. So let's talk about the field setting, because that's kind of the one that I'm most excited about, because there's where people don't really have their documents. People get a little card.
Right. So when you do register your documents, and again, you can mail those in, you can email, fax those in. There is a registration agreement that just you're giving consent for your documents to be in the registry and be viewable by healthcare providers who are licensed in the state of Arizona. And after that's done, you do receive a letter or email including a wallet card. That wallet card is voluntary to carry, of course, but it does have a code, and it does have a QR code that when viewed through a smartphone or a smart tablet, it will bring up your documents. So if somebody doesn't have direct access as a healthcare provider, your agent could provide that. You could have that in your wallet and it could be found. You could keep that on your refrigerator as well. as part of your care packet.
And you said you could make copies if you wanted to give them to other people.
You can make copies. So, for instance, I have my card that I carry in my wallet. I've laminated mine, and now my two agents have copies of that as well. So they can keep those with them. So wherever they are in the world, if they were called to be my agent and be my voice, they would be able to just access those documents.
And then also in the clinical setting, there's a solution.
Correct. So licensed healthcare providers in the state of Arizona are able to participate in the registry at no charge, and then they are able to search the registry, view documents that have been uploaded into the registry, and also assist patients with uploading new or updated documents into the registry. And so all of this is guided by state statute that guides the registry, as well as the state has very clear designation of how these advanced directives work in general.
So what does the process look like for you guys in getting people signed up?
So great question. We are doing several things. We're doing a lot of in-person events where we will share information about advanced care planning, give a little education, and then we are there to help complete those documents, witness those documents, and then upload them on their behalf. We also are doing training for healthcare providers and others, community-based organizations, legal, financial organizations, who are kind of understanding the process of using the registry, how to get people registered. And so they are then going out and doing this work. Really, the more individuals that we have who are having the conversation, normalizing the conversation at all points of care. Oftentimes physicians may say, well, I'm not the right physician to be having this conversation. But every physician who has really that relationship with a patient is the right person to at least initially start it and share information. You can also go to our website at chooseyourperson.org, and there are access to these documents, all different documents that you can use, access to the registration agreement, and then specific steps on how to register your documents. And again, there is no cost to register them.
You guys really couldn't have made it any easier.
It is often hard enough to make the decision to do this. The rest, we want it to be really seamless so that the energy that is being used is on the conversation, on taking that time, and not having it around all of the paperwork and the steps.
So Don, before we get into some of the experiences that you've seen with the peace of mind that comes with this, let's talk about Klaus Team Silver. So the Klaus Team, we want to be people's real estate agent for life, even when they don't really need a real estate agent. And that's one of the areas that you come into play with Klaus Team Silver. So tell everybody what Klaus Team Silver is.
So with Klaus Team Silver, I provide a free concierge service that guides seniors and their families to the services they need most. An Angie's List for senior services, if you will, right? So whether it's finding a reputable in-home care company or finding somebody to do your documents for you. There's a multitude of things. As many people know, my experience has been in senior living. Before retiring, I was an executive director for an assisted living building. And over the years, I've built connections with a lot of reputable, very good services. And I know which ones maybe are the ones you'd want to pass on. Yeah. So I like providing that helping hand. And like you said, it's whether you have a real estate need at that moment, it doesn't matter. This is something that's a give back to the community. We're happy to help, happy to hold people's hands and get them to the services they need most.
And you've also seen what's happened when people have planned ahead. Absolutely. And when people have kind of hit a brick wall and just realize that, wow, things are happening a lot faster than we thought.
Absolutely. The sad thing is when you find somebody, and I think over the years of incidents where maybe somebody procrastinated on doing these documents and then they have an unexpected stroke, or like you said, that anything unexpected can happen, and then you don't have the guidance and direction that you wish you had. When I met your cohort over at the Health Expo, I was just so impressed with this program, because I just think how much easier this would have made our job in a lot of incidents, to have those that do have their healthcare directives in a registry that we can access with a QR code, because moving people into senior living, which you're seeing more and more, that's part of the process. You provide those documents so that when the EMS is called, you can in turn provide it to them. So having this thing, it really excited me when I heard about the ease of which people could handle this. Yeah, that's why I'm a big advocate of this program.
So the next steps are pretty easy. You can reach out to Klaus Team Silver at klausteam.com, and you can reach out to Contexture at chooseyourperson.org. Thank you both for being on the podcast.
Thank you.
Thanks for spending time with us this week at State 48 Homeowner, the ins and outs of owning an Arizona home. You can connect with us for more information, submit topics you'd like us to further discuss. You can see relevant videos, give us feedback, answer your real estate questions, and more at state48homeowner.com.